So can you suffer from a heart attack even after a bypass surgery? The answer to this question is yes. It is possible to suffer from a heart attack, and it may be because of various causes like blockage within the grafts may form because of clotting. It may happen early within 1 month after the bypass surgery, or it may happen late. So venous grafts are more prone to degenerate and develop a clot as compared to arterial graft. So what is a bypass surgery? In a bypass, the doctor bypasses the blocked segment with a healthy artery or vein. But when veins are more prone to form a clot as compared to arterial graft, which have a longer and healthier life, they may last for years altogether. But that is not the case with venous graft. Venous grafts many times may get blocked. Percentage is 2% may get blocked within 1 week to 1 month of the graft surgery happen. So other causes are a graft atherosclerosis, that is blockages forming within the graft as they were formed in the native arteries. Other common causes are progression of native disease, like पहले जैसे ब्लॉकेजेस बनी थी वो आगे जिन आर्टरीज में ग्राफ्ट बाईपास ग्राफ्ट नहीं जुड़ा है उनमें डिजीज प्रोग्रेस कर जाए तो भी हार्ट अटैक हो सकता है. एंड अदर पॉसिबिलिटीज आर स्पैज्म और थ्रोम्बोसिस ऑफ द ग्राफ्ट. दीज आर द वेरियस कॉजेज एंड हाउ a patient may suffer from a heart attack. What would be the symptoms? Symptoms will be similar, but sometimes the patient experiences chest pain which is not as before because there has been a bypass, the nerve supplies has been tampered with. So symptoms may be atypical in a few patients, especially diabetics. The patient may experience chest pain, patient may say fatigue, unexplained fatigue, patient may complain of sweating on walking or giddiness on walking. So post bypass, if you are having these symptoms, we should rule out a heart attack. What are the ways we can rule out a heart attack? We would again do a ECG to see if there are any new changes in your ECG as compared to previous. We would have to see a echocardiography to see if there are any new onset regional wall motion abnormalities, or in other words, if there are new areas of the heart muscle which are not being supplied adequately and they show up in the echocardiography. If ECG echo do not show any changes but your symptoms are there, then we should do a cardiac marker like a troponin, HS troponin, which is high sensitivity troponin, which is an indicator of myocardial injury. If any injury is happening to the heart muscle, then the heart muscle will get broken down and it will release certain biochemical markers into the bloodstream in the form of troponin I, which can be picked up, and we can have a report within 15 to 20 minutes as soon as so we get to know that indeed suffering from a heart attack. Other than that, if the symptoms are there and even if the ECG echo and troponin I do not show any changes, we may need to perform a coronary angiography, or if there are any changes in the ECG echo troponin I, then a coronary angiography is the gold standard test. It will give us absolute clarity on what is happening, why it is happening to you. So coronary angiography would reveal exact status of the vessel. Is there any new block which has formed, or the disease in the native vessels has progressed, and why you are experiencing those symptoms. So best always is to prevent a disease as to cure a disease. So obviously prevent a disease post bypass surgery, we recommend 2 blood thinners in the initial 1 year phase. Sometimes we taper it earlier if you have any high bleeding risk, and generally we recommend 1 blood thinner to continue if there is, according to patient's individual's bleeding risk. High intensity statins, if tolerated, that has a proven role in preventing progression of disease. So my message to all the patients who have previously undergone a bypass would be, you have undergone a major surgery. So first thing, kindly continue your medications and kindly continue your regular follow-up with cardiologist or cardiothoracic surgeon, and ensure that you are taking medication. And again, focus on preventing a new blockage, controlling your risk factors which led to you undergoing a bypass surgery in the past. So controlling diabetes, hypertension, cholesterol is of paramount importance. Also, I would urge all those smokers, all those who are among those to stop smoking. It's never too late. It would reduce the risk of the grafts getting reblocked, and also it would be important for who are overweight or obese to reduce weight and control their salt intake, control their sugar intake as per their specific requirement. Thank you.